Hi, my name is Ping. I am one of the nurse practitioner students going to be taking care of you today.
Okay.
What is your name?
My name is Mike.
What are you here for today?
Just a checkup.
All right. I can help you with that. Can you tell me your full name and date of birth?
Michael Williams, January 12th, 68.
Okay. And do you know what today's date is?
April 13th, 25.
All right. Do you know what season it is?
It's spring.
Okay. Do you know where you are at?
In the clinic.
Great. Awesome. So a patient assessing his general appearance, and before I log in, I also assess the vital sign, and his speech is fluent. There is no dysphoria, and he is alert and oriented ×4. So I'm going to assess from your head all the way to the toe, and I'll be touching your head first. Okay? All right. Did you have any pain?
No.
All right. So in general appearance, he is well nourished. His skin looks the normal color. He is well looking. His vital signs are within normal limits. And I'm just looking for any bruisings, any edemas, anything, just to do a general survey. He doesn't have any malodor, and he dressed appropriately for the season. So I'm going to start looking at your scalp and your hair. So I'm palpating his scalp. It looks atraumatic. There is nothing that it's lumps or bumps. Does it hurt anywhere that I'm pressing on? His hair is evenly distributed, a little bit male pattern alopecia, and then there's a little sunspot here and there, but there's nothing nevized that it would be concerning. If I see any nevus that is concerning or nodule, I will use the ABCD to assess and maybe possible refer to dermatology. I'm going to assess your sinus, so I'm going to press kind of hard onto your sinuses, okay? So let me know if you feel any tenderness.
Nope.
Good. So how about here?
Nope.
All right. So frontal and maxillary sinus are non-tender, and next thing I'm going to do is to test your sensation. I'm going to use this little toothpick, and then when you close your eyes, I'm going to touch a few spots of your face, and then you let me know it's sharp or dull, okay? Close your eye, please.
Sharp, 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 sharp.
Do they feel equal on both sides?
Mm-hmm.
Okay, how about now?
Dull, 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 dull.
Feel equal on both sides?
Yeah.
Okay, perfect. So I'm also looking at the symmetry of the face. Can you close your eyes tight? And then you smile, big smile. Okay, you can open your eyes now and puff up your cheek. All right, so that's for testing for cranial nerve number 7. And earlier, the things that I was touching you is testing cranial nerve number 5, and they're both intact. And then next I'm going to do is to ask you to read this. So cover your left eye, and I'm going to place this 14 inches away from the patient and read the smallest line.
LTFPH.
All right, great. And then do the other eye.
LTFPH.
Okay, so your eyesight is 20/20, and that's cranial nerve number 2. It's intact. Next time, I'm going to shine light to check your pupil, okay? You just look straight. Both pupils are equal, and round and equal, and they're about 3 millimeters in size, and then doing reflective to light and accommodations. I'm going to check for your eye now. So first look at your eyelid. There's no mass, there's no edema, no redness, no erythema. And then your eyelashes are evenly distributed. And then your sclera is white. And I'm going to pull it down to check your conjunctiva, okay? Conjunctiva is pink. Perfect. And then you look at my finger and then just follow it and keep your head straight, okay? eye movement is smooth and there's no net tetanus. And I'm going to check the back of your eyes. So I'm going to use this ophthalmoscope to look the back of your eye. I'm going to check your right eye first. So I'm going to cover my left. Normally I have to turn off the light, but we're not going to do that for this exam. So let's see. Red reflex noted. I'm going in. Alright. So optic disc is yellowy orange. And come to cups ratio is 1 to 3. And look straight to the light. Alright. Macula is seen and no bleeding is noted. Alright. So I'm going to do the other eye now. Okay, do the same thing. Just look straight, kind of like over my shoulder, okay? So red reflex noted. Going in. Looking at the back of your eyes. Find the optic disc. It's yellowy orange. And these two cup ratio is 1 to 3. Look straight. And then macula is thin and there's no bleeding in the retina. Perfect. So for the eye movement, it was testing the cranial nerve 3, 4, and 6. After that, well, I'm going to look at your nose. So I'm going to first inspect the outside of your nose. Doesn't look like there is any trauma, there's no scar, there's no lesions. And then just tilt your head up a little bit. I'm going to look inside. You shouldn't feel any pain. Okay, so the septum is in midline, there's no deviations. The nostril is mucosa is pink, and then the turbinate is cherry red. And then I'm going to do the other ones. The mucosa is pink, there's no polyps noted, and turbinate is cherry pink. Are you okay?
Yep.
All right, perfect. So after that, I'm going to check your mouth. All right. So if you can just open your mouth, I'll make sure that you have nothing inside. Okay. All right. Turn on the light. I'm going to use this tongue blade to move your tongue side to side. Let's just check under the tongue here, under the tongue there, and then all your teeth are no chipping. Okay, the mucosa looks pink. There's no lesion noted. I'm moving the gum line here. All right. There's no lesion noted. The tonsil is grade 0. You only really have one. Just say Look in your uvula. It's midline and it's elevated and it's pink. All right. I'm going to do a little gag reflex to just check on your tongue. Okay. Sorry about that. All right. So that was a cranial nerve 9 and 10. It's intact. And can you suck out your tongue? And then do side to side. All right. Tongue is midline, and that's cranial nerve number 12. And then I'm going to just have you shrug your shoulder. That's cranial nerve number 11 is intact. And then I'm going to check your ears now. Okay, I'm going to start with your right and then going to the left. So before I start, I'm going to look at the outside of the ear. The outside of the ear looks atraumatic, no erythema, no edemas. If it hurts, tell me, okay? And then I'm going to, there's no drainage noted. I'm going to put a otoscope inside to look at the canal. The canal has, I'm going to pull your ear too, okay? I'll be very gentle. And the canal looks dry. There is no wax presented. Tympano membrane is purely gray. All bony landmarks are seen. And cone of light is at 5 o'clock. Okay, I'm going to do the other one. I'm checking the pinna, checking the chaga, checking the outside. There is no scar or any erythema. I'm going to put the otoscope inside your ear. There's no ear wax in the external canal. And then I'll go inside. And I see the tympano membrane is purely gray, and cone of light is at 7 o'clock. All bony landmarks are seen. Perfect. Are you doing okay now?
Doing great, thanks.
All right. So I'm going down to your neck now. So and before I palpate your neck and all these lymph nodes, I need to listen to see whether there is any bruit or abnormal sound of your neck first. Okay. So when I put my stethoscope on it, just hold your breath. Okay. All right, great. There's no bruit noted, so that means I can be safely to palpate your neck. I'm gonna check the trachea. The trachea is midline. It's no deviations. Your thyroid is just swallowed. Okay, so the thyroid move up freely. I'm going to palpate your thyroid, pushing it, supporting from the right side, and then I'm going to pushing it to palpate for nodules. It feels soft. And then I'm going to do the same thing on the other side. No nodules filled. Okay, I'm going to palpate your lymph nodes. So pre-auricular, post-auricular, occipital, and then I'm going to tonsillar, submandibular, mental, inferior cervical, and then posterior cervical. You have any pain here anywhere? Okay. So the most of the lymph nodes are very discrete and small and non-palpable. The one that palpable is soft, weighs 1 millimeter, small, very small. And then I'm going to press on here. These are non-palpable lymph nodes. Great. And then I'm going to check your pulse. Okay, so, and then brachial. Yeah. Carotid. All right. They're +2, and then they equal. And then I'm going to feel your pulse here too. Okay, tibial, and then pedal. All right, great. They're equal on both sides, and +2 all throughout. For your skin, I'm also looking at the temperature is warm, the color is white, it's pink, and then skin turgor is good hydration status. Checking your nails for capillary review. They're brisk, less than 3 seconds. How about this one? They're all brisk, less than 3 seconds, and no coupling on the fingernails. Perfect. All right. So far so good. So I'm going to listen to your heart and lungs. Since you're sitting up, maybe I'll just check your reflexes also. Okay. So I'm going to check your brachial reflex and just relax your arm like that. Perfect. Okay, I'm going to find your tendons and then just go like, okay. Oh, perfect. That's brachialis. This is bicep. Just go like that. And now find the bicep tendon. All right, and then I have the tricep, and then you just relax. All right, that's +2, brachialis, and then here is the bicep, and then tricep. All right, and then patella, you have to scooch up a little bit higher. So we're going to do patella tendons right here, and then here +2, and then here, and Achilles. All right. They're all +2. They're equal on both sides. That's the main thing. And then we're going to listen to your heart and lungs. So first, I'm going to listen to all of your lung field. And each time when I put a stethoscope on it, you just take a breath from your mouth. Okay? Breathe in and out. Okay. all lung field sounds clear. I'm going to listen to your back of your lung also. Okay. Okay. Same thing. All lung fields are clear bilaterally. There's no adventitious sound. Can you say 99?
99. 99. 99. 99. 99. 99.
Okay. Sounds are muffled and no bronchoscopy noted. And then I'm going to ask you to do 99 also.
99. 99. 99.
Okay. Sorry. And then say 00.
00. 00. 00. 00.
No tactile spermatus noted. I'm going to hit the back of your real quick for the see where you have any pain. Okay. Any pain?
Nope. Nope.
Okay, good. So there is no CVS tenderness. So I'm going to listen to your heart also.
Okay.
I'm going to use my diaphragm to listen for the valve. Aortic, pulmonary, or spine. And then I may use a belt for, sometimes it's better here, tricuspid. Mitral valves. And then I'm going to find your PMI, which is the left mid clavicular line and then fifth intercostal space. And I'm going to listen to it. S1, S2, heard, no murmur, can noted. All right. Are you still doing okay?
Great.
Okay. So now I'm going to have you, actually I forgot to ask you to check your patency of your nose. So
Sure.
can you cover one of the nose and then take a deep breath? Okay. Good. It's not blocked, right? All right. Sounds like you can breathe well on both sides. Okay. So now I'll have you laid down.
Okay.
Okay, I'm going to check for your neck. Is the next thing I'm going to do is to check, see whether you have any regurgitation. We need to put the patient on a 30 to 40 degree. I don't have a bed like that, but just turn your head a little bit to the left, and then I look for the pulsation. And then I put the card, the highest point to here, and then just measure the height of it. About 1.5, 2. All right. There's no JVD noted. Okay. While you lay down, I'm going to just make sure that check all the skin that you have in front and the back, and then I'm going to check your do an abdomen exam. Before I do an abdomen exam, I'm going to listen to 4 parts of your abdomen. Okay? So might be a little cold. Sorry about that. Normal reactive bowel sounds heard on all 4 quadrants. Before I push you, did you go use the restroom before you came in?
No.
Do you need to use it before I palpate?
No.
Or you're good? Okay. All right. So I'm going to press on your abdomen, and if it hurts, let me know.
Okay.
Okay. So I'm going to do a gentle, light palpation just to feel.
Okay.
Also, I was inspecting the abdomen before I listened. The abdomen doesn't have any palpation, pulsations, and the abdomen was flat. And then for the palpation portion, the abdomen is soft, non-tender, and there is no mass, palpable mass. I'm going to do a deep palpation, okay?
Okay.
You let me know if you can feel anything hurting, okay? There's no palpable mass. It's soft and non-tender. I'm going to do a check your liver size.
Okay.
Palpate. Okay, take a deep breath in. Thank you. The edge of the liver is soft and it's right below the costal space, and that's a normal size of a liver. Okay, let me check this one. The spleen. The spleen is non-palpable, which is a good finding. I'm going to check your kidney. I cannot feel your kidney. And then check this kidney. Kidney is non-palpable. I'm going to do a McBurney check. See where you have rebound tenderness. Does it hurt when I press it down?
No.
Okay, good. No rebound tenderness noted. And then now I'm going to just kind of tap on your abdomen, okay? I'm going to do 2 in every quadrant. Tympani is heard throughout the whole 4 quadrant, and you have to hear the tympani changes to dullness, and that's the border for your liver. So it sounds like it's 7 centimeter long. Okay, now I'm going to check your, can you stand up please? All right, great. I forgot to podcast your back, so I'm going to do it real quick. So resonance heard on the lung field. And next is going to check your range of motions and strength. So can you lift up your arm? Lift it up high and go in the back like that. Yep, then you go back down and go to the back like that and touch your scapula. Perfect. And then go up and up the full range of motion down the shoulder. Do your elbow. Go up and go out this way, and then go back in this way. Perfect. And then do your wrist out, and then like this, full range of motion noted. I'm going to test your strength. Just push me, okay, and then pull me. Perfect. And then do the same thing on your hand. Pull, okay, push. Perfect. And then squeeze my hand tight. All right, strength is 5 out of 5 on all upper extremities. And then for your lower extremity, can you just kick? Yeah, and then just go like this, up and down. Yeah, and around. Does it pain anywhere?
No.
Okay, full range of motion is noted. Also, open up your hip and then close your hip. All right, perfect. And then take a walk, please. Look at your gait. All right, gait is steady. All right, perfect. I'm going to do a rumble test, which I'm going to have you put your feet together and look at me. All right, and you're not swaying. And then close your eyes. Okay, and then you're not swaying. So it's a negative rumble test. Perfect. And then I'm going to check your back for your scoliosis. So just bend down. All right, checking the size. All right, it's straight. There is no curve to one side or the other. It's in midline. Perfect. No scoliosis noted. Do you have any question for me?
No.
All right. Thank you very much.
Thank you.
Have a good one.
You too. Thanks.